Hello, I'm Rob Storey from Sheffield in the UK. I welcome you to this session on pollution and cardiovascular disease, and it's my pleasure to be joined by Professor Raimund Erbel from Essen in Germany. So Raimund, what is pollution and why should we worry about it?
Pollution is summarizing the environment where we are living, and it is including the noise, it is including the air. If we have bad air, it is including the traffic which is around us, it is including the greenness of an area where we are living, but also the psychosocial factors of the area where we are living and influencing us. And it is a bad situation when you have a lot of particles in the air, when you have a loud surrounding, when you have a tight neighborhood, because all these factors are influencing the atherosclerotic disease and coronary disease, stroke, as we have heard.
So noise, particles, the greenness of the environment,
yes,
and these social factors, they're all having an impact on our cardiovascular health, is that right?
That's right, and clearly studies have shown this over many years, that clearly these are risk factors for health, and particularly for coronary and cardiovascular disease, even heart failure. And therefore, things have to be put forward not only in summaries and reviews, but it have to be taken into the activities of the societies.
So there's been lots of research showing there's an issue here. Do you think we're still underestimating pollution as a cardiovascular risk factor?
Yeah, despite the fact that in meta-analysis and good reviews, these factors are listed as high-ranked risk factors, even beyond others which we know. They are not included in guidelines or in statements of the societies, and this has to be one of the next steps where we are working on.
So this is really serious. You're saying that we've got a blind spot in the guidelines to this issue of air pollution, whereas you know, we talk about smoking and lipids and blood pressure, but we seem to be blind to this problem when it comes to the guidelines.
Yeah, how can the general population expect from politicians that they do something when we as a society, as we have the data, are not pushing the data forward so that the politicians can make their decisions based on guidelines and education efforts which we have as a society done.
So what's your sort of vision for the future as to what we as a cardiology community can really do to tackle this problem of the link between pollution and cardiovascular disease?
Yeah. Clearly we have to include in the guidelines summing up the risk factors of cardiovascular diseases, the noise, the pollution by the air, the neighborhood, social factors, the greenness, and it is important to do it now because the personalized medicine is even able to demonstrate for individual people, individual areas where we are living, what is the pollution, what is the noise, and what is the greenness surrounding you.
So the ESC is launching a campaign about this issue. Do you think that's the right direction then?
Yeah, the right direction, but more important, I think, to really include it in guidelines. Yeah, and not only make efforts on distributions of information. When we have guidelines on prevention, in these guidelines, this has to be included. When we make guidelines on hypertension, we have to include that noise and other factors are increasing blood pressure.
Well, thank you very much indeed, Raimund. That's great to have your insights into this, and thank you, the audience, for listening to this session. To summarize, we now know that there's this major link between many aspects of pollution and cardiovascular disease. It is a major risk factor, and we as cardiologists have to be much more active and get on board with initiatives, pressurizing politicians and making sure this message gets into guidelines to make sure that we can do everything possible to improve cardiovascular health in the future. Thank you for joining.